Welcome to today's episode of SPH Behind the Scenes. We're going to be visiting the Institute for Global Cancer Prevention Research. We'll walk this way. So we're in the Cancer and Cardiovascular Research Building, a beautiful building. We're heading up to the second floor to meet with SPH faculty member and founding director of the Institute, Irina Stepanov, and some of our colleagues to discuss a bit about what the Institute's all about. So this Institute was pulled together in 2021 as a collaboration between the School of Public Health, the Masonic Cancer Center, and the medical school. And so collaboration and partnership is a foundational element of this Institute's work, and we'll hear more about that today. Hi, Irina. How are you? Good to see you.
Good to see you.
I have, you wanted Earl Grey tea.
Yes,
Here's
thank
that.
you.
You and I had known each other a bit, but I think the audience would really want to know more about you. So a little bit about where you grew up, your childhood, and what led you to do cancer research and tobacco research.
So I was born in Chisinau. It's the capital and the biggest city in Moldova. Do you know where Moldova is? Good. Usually I have to start with a lesson in geography because it's such a tiny country. It was part of Soviet Union, as you know, and so it was a typical Soviet city girl childhood. You know, a lot of homework, classwork, much more than kids have here. So that was a big part of growing up, and then household chores, because me and my sister were responsible for everything. Our mom was working 3 shifts. So pretty, basic kind of childhood, but I had a passion for ballet. So this is something I can remember with, warm feelings. So I spent a lot of time after classes dancing, and actually could have become a professional ballerina, but Mom decided it wasn't working out. So, which is good because now I'm doing this wonderful work. And then I had this opportunity to come here to Minnesota. I actually work with Stephen Hecht. And that was really amazing. I was already interested in cancer prevention at that time. That was because I wanted to do something that would be a little closer to real life impact that I could do with my degree in chemistry. So playing with test tubes in a lab is fun, but wasn't sufficiently fun for me. And so that was area that was kind of came up, and I was able to engage in. And also then we lost our mom to cancer, that reinforced the commitment to cancer prevention. And then just coming here, working alongside Dorothy Hatsukami and Stephen Hecht, and seeing how you truly can, use research to put it to work, to actually use it to to work towards prevention of cancer through policies and practices and
so translational
individual behavior change. That was really inspiring, and I knew this is what I want to do. This is what led me to work in India, primarily because there are such high rates of smokeless tobacco use. So people don't smoke, they chew tobacco. But beyond that, there's very little local data to support tobacco control. And this is where it desperately needed, because rates of oral cancer are extremely high. So pretty much India contributes to the majority of oral cancers in the world. Really? Imagine if you could do something about it. And it's people of low income, low educational attainment who, use these products. They are very inexpensive. And by the time they show up at the clinic, it's usually a later stage. So they either don't survive or get, horribly deformed, and its quality of life is affected as well. So, if you can do something about it, you can eliminate the majority of oral cancer deaths in the world, pretty much. So this is what kind of drives me when it comes to tobacco, to research that informs tobacco control globally. But I'm also interested in environmental exposures, because tobacco alone, can be, exposure to tobacco can be exacerbated by other exposures to environmental toxicants, but also psychosocial stress. So it's not just one thing.
So I know that you have a lab, and I would really like to see that. I'm wondering if you can show that to me.
Sure, I'll be happy
follow
to
you.
show. Obviously capacity building is the major focus for the Institute. We are working in India, of course, but also building collaborations in Malaysia, in Thailand, and in other countries. So the vision is to have like a global consortium of research hubs that will employ these cutting edge but also uniform approaches to generating data to support cancer prevention efforts. And so that is one part of the mission. Another part is innovation. So this is really important because many tools that we have here that we use are hugely expensive, and it's just not feasible to do something like that in places that need it the most. So kind of supporting democratizing research tools so they can be so we can use them in rich populations that need it the most is another part. And lastly, translation, of course, kind of through evolving implementation research field to actually, helping to make this data work in other countries. So we have smoking machines, we have all chemistry, laboratory equipment that is necessary to analyze tobacco products, to analyze environmental samples, to do chemical analysis of biomarkers. But what I wanted to show you is part of the Institute, the new translational exposure and effect resource.
Great.
And it is in this room. So we will change the label later. This is part of the translational resource, which will include chemical analysis of harmful agents in the environment or environmental samples, including tobacco or other products, in vitro exposure studies, in vivo animal exposure studies, and human trials of exposures and biological effects. So this is part of the Institute's effort to facilitate tobacco research and environmental exposure research here at the University of Minnesota. So we will make it available to people to do translational research. But also it's part of our effort to bring trainees from other countries and learn how to do some of these procedures. So I can just show you, for example, this is vaping machine. It's hard to tell what it is, but it is a Cadillac, or I don't know what is the best brands to compare
Top of
it
the
to.
line. I mean, it's clear that you have a global focus. I mean, it's in your title. But I've also heard that you're working with local immigrant communities on some work. I'm wondering if you can say a little bit about that.
Yes, it's actually, it is definitely important because global is local, local is global. One important area where we have really shared interests with some of the communities is secondhand exposures from hookah use. And I actually have a graduate student here
I'd like to meet
who
her.
works on that, and
Yes.
she actually brought that passion for this area of research herself. And she also helps us with air pollution studies. So she's developing some tools to measure
Is she nearby?
particles. Yeah, she's in the lab. I can
All
show
right. Hi.
This is Dean Beebe.
Nice to meet you.
Very nice
to meet you.
And Itoro Uwat. This is her first year as a graduate student in our School of Public Health. And she just reached out to me one day, and we had a Zoom meeting. And her really drive for public health was so impressive. I immediately said, yes, I'll take you.
That's great.
Yeah.
That was a quick one.
So maybe Tara can tell you a little bit more
Yeah,
about what
I'd like to
she's
hear
doing.
more. Thank you.
So, yes, and I will.
I'll see you in a little bit.
Yes.
Okay, so I've been working on developing biochemical methods for the chemical characterization of air fractions that are obtained using personal air sampling devices. And this is in preparation for some of our community and global-based studies that are centered on secondhand smoke exposure as well as air pollution. So how we translate all of this to our community-based studies is that we have our participants wear these passive air sampling devices that I had shown you, but they are attached to wearable vests as well as bags. So can you give me a second to bring an example?
Sure. This just looks like a normal vest that you would wear hunting in northern Minnesota.
Yeah, it's improvised from a fishing vest actually.
Oh, is it really?
Yeah. So this is the passive sampler, and then this is the virtual impactor, which is powered by a pump. Here, can I turn it on so that you have some noise?
Impressive. So they wear this 8 hours a day?
Yeah, 8 hours a day. How does it feel?
Like I'm wearing a vest with stuff in it.
I mean the vibration from the pump. Do you feel the vibration?
A little bit. It's not like, you could it'd probably like be after a while be like white noise. You could get used to it, right?
Okay, yeah. The sampling devices are placed close to your breathing zone, and then these two sample air based on passive sampling, and these samples air based on active sampling. So this actually like separates the particles in the air trapped based on their particle sizes, and then this traps specific chemicals. So
Okay. So this is like actively drawing in.
actively,
Okay.
and it's powered by a pump, by the two pumps.
Yeah. Okay.
And then this is passive sampling.
All right.
So it measures contaminants within the breathing zone of the air that you
That's
breathe.
fascinating. This has been very informative. You have some amazing equipment here. Take this off and give it back to you. I won't wear it home. So thank you so much. I appreciate you taking the time to meet with me today. Did very impressive work. I would like to meet with Dr. Dorothy Hatakami next. Can you bring me
Sure,
to her,
I can.
please?
And it's been an absolute pleasure having you
Oh,
around.
likewise.
and
Thank you
trying
so
out our
much, and
best.
it's so great that to see you as a second year PhD student
Thank you.
in the lab
It's
and
been
at
a
work.
pleasure. Yeah.
So yeah, I mean, take care.
Hi, Dr. Hatsukami.
Hi,
It's
hi,
good to
Dorothy.
see
Good to
you.
see you. Good to see you.
Yeah, good to see you too.
Thanks for taking the time to meet with me.
Absolutely.
We've met each other a few times, and
Yes.
but I largely know you through reputation as a world-class researcher from the medical school.
Well,
So can you just say a little bit more about your role in the Institute and what work you're leading here in the Institute?
yeah, my role is to be the deputy director of this institute, and largely helping to inform some of the research that's being conducted of the institute. So yeah.
So what
yeah.
what is your particular area? I know that you're internationally known for your work in tobacco use. So what are you working on now that really excites you?
One of the things that really excites me, the type of research, is we've been taking a look at the impact of regulating the addictiveness of cigarettes. And cigarettes is what kills half its consumers. It kills about 500,000 people in the U.S. each year.
That's
It's
mind-boggling.
tremendous. It's just tremendous, and about 7 million worldwide. And we know that it's the addictiveness of cigarettes that has the tenacious hold on its consumers. And so by reducing the addictiveness, we believe that we can prevent youth or young adults from becoming dependent on cigarettes, and also it would help facilitate smokers to quit smoking.
This is an incredible potential impact of the work. But where do you think that the Institute might have its greatest impact, kind of unique impact on what's known or what can be done?
The biggest impacts is the effort to build capacity within low and middle income countries to develop capacity to do research.
Thank you for that. I know that another colleague of yours from the medical school, Rahul Gabre, is also works in the institute. I'm wondering if you can bring me to see and meet with her. I know she's meeting with Irina.
Yep, let me take you there.
Thank you so much.
Yeah.
Thank you so much.
Yeah,
It's a
thank
pleasure
you.
hearing
It
about
was
what you're
really
doing. It's
meeting
good to
you.
see you.
Yep.
Informative. You bet.
Yes.
You bet.
Yeah,
Thank you
okay,
so
great.
much.
Bye.
Hi, Tim Beebe.
Nice to meet you.
I'm Interim Dean of the School of Public Health. It's nice to meet you.
I'm Rahel Gebra. I'm a professor in the Department of Obstetrics
Great.
and
Let's sit down and
Gynecology.
have a little chat if you wouldn't mind.
Yeah.
So I know that your specialty is in gynecological oncology. And just say a little bit more about like what you do in the Institute and what sort of work you're leading here.
Sure. So my work in global health has been primarily in sub-Saharan Africa. I started it now almost 10 years ago, and for a few years actually lived and worked on a global health project on site. But I've been in academic medicine for a while, and I stay in academic medicine because I really believe that training is critical to sort of change. It's transformative. So when we were building out the Institute, we really wanted to make sure that we incorporate that into the plan and the vision, that we not only conduct research, but we bring others along with us in that pathway. We work alongside with them, and we also train them to be independent investigators. So I lead the training program within the Institute with that aim. We work with our colleagues to think about that and to incorporate that into their work.
So, I mean, I know one of the goals of the Institute is to build capacity, but you're describing capacity in multiple ways, right? Human capacity toward independence in investigation, structural capacity, Irina was talking about, lending some of the equipment that we have that others can't afford, so it's capacity building is a big thrust of the Institute. And, the training is building up like the next generation of investigators as well around the world. So, that sort of an international global focus is I wasn't aware of that until I started talking to people here. I probably should get out more.
It's always good.
And that's amazing. It's a lofty and laudable goal, and I appreciate all the work that you're doing in that. And I appreciate this collaboration between the School of Public Health and the medical school. I think it's great, in the Masonic Cancer Center. So thank you so much for taking the time. It's very impressive.
Absolutely. Thank you for making the time to visit us.
You bet.
Yes.
Take care.
Take care.
Bye-bye.
Bye.
So, the U.S. has been working on ways to prevent tobacco use and smoking, knowing its incredibly harmful effects. But we've been working on it for decades. But it's clear from our discussions today that other countries are at the same place. They're starting early on. And so one of the goals of the Institute is to build that capacity around the world to do this important life-saving work. And it's just amazing to have this here, and we're so grateful that Dr. Stepanov is in the School of Public Health leading this work in collaboration with the medical school and the Masonic Cancer Center. Well, thank you for tuning in today. Stay tuned for our next episode of SPH Behind the Scenes.